Hello, my name's Rhiannon Lester. I'm going to apologize for my voice ahead of time. This is my presentation on data sets. What are they and why do we care? So this is for GNSG 6700 of my nurse practitioner program taught by Dr. Deb. Data sets, what are they? So in healthcare, data sets are a collection of data elements organized into a specific structure, making it possible to analyze and extract meaningful insights. That's going to be very important as we move forward. In this presentation, we're going to talk about why that they need to be organized in order to get those insights out of them. These data sets often include information related to patient demographics, diagnoses, treatments, outcomes, and other relevant healthcare metrics. They are essential for maintaining statistics, ensuring data capture for patient management, and supporting clinical governance. So, great examples of websites that are a preponderance of data is healthdata.gov, World Health Organization, Human Mortality Database, National Center of Health Statistics, OpenFDA. Other examples we can think of are like the CDC or NHANES. So what do we do with these websites and why do they matter? So just looking at like OpenFDA, they have data on drugs, devices, and food. So let's say we're seeing E. coli outbreak from a certain food. Well, that's going to matter to us as practitioners. Obviously, if we're seeing high rates of E. coli, we want to address that and try to nip it in the bud and give the information out of where that source is coming from. So that is what the FDA is able to track. Devices, I'm going to get a little bit into that further on, but we're talking about artificial joints and things. If we're seeing issues with maybe something being contaminated, that's going to matter to us. Also, tracking of different disease states or different, like if the flu is coming, what strain is it? That's going to matter to us as well. And that's all things that we can access through the CDC. That's honestly how we were able to track COVID data. So that's going to matter to us as nurse practitioners actually applying this data to our practice. So why is data important? Well, we should be evidence-based clinicians as nurse practitioners. So what we recommend to our patients should be backed by science. We shouldn't be ever making a recommendation just willy-nilly based on how we feel. We should have some data to support what we're recommending. So this allows us to have evidence-based care and provide safe, quality healthcare. This is going to be utmost in our practice as nurse practitioners. So how do providers utilize these metrics? We have enhanced decision-making abilities from data sets. These are often collected like through the EMR. This can be from, certain medication recommendations and being flagged that we don't want to give that medication based on whatever diagnoses maybe this patient has, or having a whole health history so we can better make decisions based on a full picture. Because, of course, as practitioners, we want to be holistic in care and look at the whole person. So, having obviously a proper medical history is going to be so important. Predictive analytics. So, big data analytics can predict clinical outcomes and complications. For example, so I talk about certain medical equipment and related sequelae, but a great example that we see in like plastic surgery is we will follow lot numbers of implants. And if we start to see issues with like a breakdown with that implant, we can go further and bring back patients that might need a change in order to be safe long term. Health equity. Data sets can help us identify health disparities. So if we're seeing a marginalized group, we can do better to actually help them and raise them up so they get the quality care that they deserve. Key tools, of course, that we use in order to collect data is the EHR systems, clinical decision support systems, telehealth platforms. A great clinical decision support system example is UpToDate. So we curate a bunch of evidence from the research, and it goes there, and it gives you the most up-to-date recommendations based on uh, what we have for evidence. So certain disease states, it'll have differential diagnoses, different modalities for treatment. So it's great. It's huge in practice as nurse practitioners. The benefits are improved accuracy, reduction of errors using digital tools, preventing medication errors, preventing overprescription, enhanced collaboration, easy sharing of patient data with disciplinary teams. We'll talk a little bit more about that as I move forward. Accessibility, real-time access to patient history and lab results. So, as you have all likely seen, it is wonderful how we are able to just pull patient information right away as soon as the data or the lab releases it to us. We can see it right away. So it is quite incredible how quickly things move now in healthcare versus in the past. So how do we manage all this information? Without organization, data is fairly useless. We can compile and compile information, but if it's not user friendly, it's just numbers, it's just information without any ability to actually extrapolate anything. So, interoperability is the ability to exchange and use information across different healthcare systems. This is so important, especially with how healthcare is moving and how the world is growing. We need to be more connected. Just looking at, for instance, Rochester Regional and U of R, and our ability to move across those healthcare systems and share information. That's huge. Having care everywhere, amazing. Being able to pull information from other hospitals. Perhaps we have a CAT scan or something that we need to see. We can pull that and actually see it to create a better picture of how we're going to help this patient. And that comes to health information management, HIM, where we can mass um, pull information on a patient to help with holistic care. And then digital transformation. Healthcare organizations are increasingly adopting digital platforms. So this is huge, just to make it easier to access and have everything in one place and to pull it from one healthcare system to another. I think we can all think of examples of this. And then why this all matters to us, because we want to empower ourselves through data, right? We are leveraging this information to create safe care as family nurse practitioners. So that's really why we care that this data is being collected in order to use it for actual exceptional patient care. We want to be increasing patient safety through having full access to their medical records, reducing errors, whether it be related to medications or misdiagnoses, advancing quality. So, actually having enough information about the patient to give them the proper care they need. Maybe they're struggling with, mental health, and we need to coordinate in order to get them those services. So, having the ability to have data like where are we going to find these healthcare practitioners who focus on mental health? Those are going to be the things that our EHR and our ability to access information from different avenues it's going to benefit our patients' care. So together we can bridge the gap between data and meaningful care. So taking it from just an arbitrary number to actually applying it. Thanks. These are my references. Thank you for watching.